Patients will often ask about hip resurfacing versus total hip replacement. We were fortunate to be trained in Canada. We had some very early exposure to the Birmingham hip replacement resurfacing device and have actually performed some very early on in our careers. The resurfacing, so that you understand what it is if this is your femoral head and this is your socket, instead of cutting the head off and putting a stem down like we showed you in the other video, we just put a metal cap on. So there'd be a metal cap sitting on the top of the femoral bone, and then there'd still be a cup. And that metal cap would be rubbing inside the metal cup of the acetabulum. So the resurfacing is a bigger ball, and so some of the initial thoughts with resurfacing were that, okay, it's the same size as the original ball, so it's bigger, it's more stable, people will get better range of motion, and lo and behold, because it's metal on metal, it'll wear less and last longer. So, there were a lot of proponents that said resurfacing should be done in younger patients, active patients. There's a few issues with resurfacing in general. The biggest for me is that it's a metal on metal bearing surface. I've revised a number of them over the years. I think there are some resurfacings that are put in perfectly well and do okay. I've also seen other resurfacings that have been put in technically well. They didn't notch anything or malposition the components, but the patient still ends up with a painful hip with some of the metal on metal ions and debris and the things that are associated with the metal ions that we discussed earlier in one of the other videos. So my personal preference is to not do resurfacing because I feel like a well done anterior approach total hip through the front interval where we don't cut any muscles or tendons, we put the parts in that are sized for your anatomy, and we use the ceramic ball on the cross-linked polyethylene liner. I think that's a very safe, less invasive way for you to get a great result without having to do a resurfacing and potentially run the risk of a metal on metal bearing problem.